Dr. Rajashree?
Sir, I'm from Gulbarga, Karnataka.
Karnataka.
Good morning, everyone. Today I'll be presenting a paper on bilateral disc edema in patients of hypothyroidism. So papilla edema is clinically defined as optic disc swelling secondary to raised intracranial pressure. Unilateral or bilateral optic disc swelling requires the clinician to obtain a thorough history, perform a detailed general, neurological and ophthalmologic exam to develop a broad differential diagnosis. Commonly encountered causes of papilla edema include Mars lesions, cerebral edema, hydrocephalus, shunt failure and idiopathic intracranial hypertension. Less frequently encountered etiologies of papilla edema include systemic disease processes and medications. It is important for the clinician to consider these other medically treatable etiologies before attributing papilla edema to idiopathic intracranial hypertension and considering an invasive procedure such as CSF shunting. Hypothyroidism is one of the rare causes of disc edema. So the purpose of our study was to study the association of bilateral disc edema with hypothyroidism. A total of 8 female patients in the age group 22 to 38 presenting with severe headache were included, and this study was done in our hospital in Gulbarga over a period of 3 years. On fundus examination, they were diagnosed with bilateral disc edema. All patients underwent systemic evaluation including the blood pressure, sugar levels, lipid profile, thyroid profile, MRI and an neurophysician opinion. These female patients had varying degrees of hypothyroidism. On examination, patients were alert and cooperative, visual acuities were normal, pupillary reactions were brisk and there was no color vision deficit. No visual field defects were noticed except an enlarged blind spot in cases of established papilla edema. The extraocular movements were normal and there was no diplopia. Fundoscopic examination revealed bilateral papilla edema without any hemorrhage or exudates. Thorough slit lamp biomicroscopy using a 78D or 90D lenses were done to rule out pseudopapilla edema. Neurological examination revealed no abnormality, and the history of any systemic medications was not significant. Out of the 8 patients, 5 patients were married, out of which 4 had history of infertility, and gynecological history revealed menstrual irregularities in all the patients, and MRI revealed features of raised ICP in 3 patients who had established papilla edema, and CSF analysis of the patients showed elevated protein levels in all the patients, and thyroid profiling was done, and all of the patients had an elevated TSH and reduced free T3 and T4 levels. This is a picture showing a fundus foot of one of the patients, and thyroid profile TSH was mean TSH was 32.68 micro international units. Free T3 was 2.28 picogram per ml plus or minus 0.62. Free T4 was 0.86 plus or minus 0.06, and all the patients showed elevated CSF protein levels with a mean being 330 milligrams per liter. BIH is defined by modified Dandy's criteria that include symptoms and signs suggestive of increased ICP, normal CSF composition and no abnormal neurological finding. And neuroimaging plays an important role in excluding secondary causes of increased ICP. CSF opening pressure is another important diagnostic procedure which has to be more than 250 millimeter of water. So thyroxine alters the CSF dynamics by affecting the sodium transport, and this in turn leads to elevated CSF protein, and this was found in previous studies like Frost et al. So coming to conclusion, hypothyroidism is a causative factor for bilateral disc edema in female patients, which can be diagnosed by simple serological tests. Treating hypothyroidism shows complete resolution without any residual visual field defects. Thorough evaluation of the patients will help us in diagnosing the cause and treating it in resulting in complete recovery and avoiding any surgical interventions like CSF shunting. Thank you.
So what's your take home message from this
presentation?
So, whenever a young female patient comes to you with signs of raised intracranial pressure and has a history or gynecological history of infertility or menstrual irregularities, we can get a thyroid profile done so that we can rule out one of the rare causes of bilateral disc edema.
Basically, taking a good history in any patient with papilledema is really important to rule out the other causes. So even like hypervitaminosis or oral contraceptives or any of those. So that is really important before you label them as BIH or anything, or you subject them to a invasive investigation.
Yashashwini,
Yes.
according to the studies, you must have gone through all the papers. I'm not aware of them. What is the percentage of people who are having such hypothyroidism do land up in papilledema?
Sir, actually most of the previous studies which have gone through, the papilledema is most commonly associated with hyperthyroidism. But this is one of the cases, these are the few cases which we
Exactly,
found out.
I was hinting on the same thing which you have asked. So,
Yeah.
there is no linear relationship that this may happen. It's one of the rare causes,
Sir,
hypothyroidism.
Yes.
And the treatment is conventional. Just
Yeah,
treat
sir,
the
if we
hypothyroidism
treat
and
the hypothyroidism,
the things will come back. And the recovery is full as per your suggestions.
Thank you.